All right, I want to cover what base excess is, also sometimes called base deficit. And this is a result that you will see given on like an arterial blood gas reading. Little side note, I'm going to be coming out with an ABG crash course very, very soon, so stay tuned for that. All right, so a normal base excess is -2 millimoles per liter to +2 millimoles per liter. A great way of kind of describing base excess, and I actually saw this online, is it is a poor man's indicator of the metabolic component of an acid base balance. So essentially, if you have negative base excess or a base deficit, so let's say you have -3, -4, -5, this is going to contribute to a metabolic acidosis. Whereas if you have positive base excess or too much base, excess of base, let's say it's +3, +4, +5, +12, whatever it may be, this is going to contribute to a metabolic alkalosis. Just as a side note, as nurses, yes, we do look at base excess and deficit. Sometimes providers may ask for it. But when it comes to interpreting an ABG, it's not really factored into the interpretation as far as determining, like, is this a partial compensated respiratory acidosis versus a fully compensated metabolic alkalosis, whatever it may be. So it's important to know about base excess. It's good to know what it is, how to find it, what too much or too little means. But when it comes to interpreting ABGs, we don't really use it in the equation.